Dr. Therian here, and if you're watching this video, we likely just talked about floaters during your eye exam. Now, this short video is not to replace an eye exam, it's just to help reinforce what we talked about during that eye exam. So we've got this gel-like substance called vitreous inside the eye, and it's 98% water, a little bit of collagen fibers, a little bit of hyaluronic acid. But as we put candles on our birthday cake, as we have trauma, that type of thing, that fluid will start to become a little more liquefied, and it can have little pockets that's more water, more pockets that are some collagen fibers or hyaluronic acid, and they can kind of get stuck to each other. And when those things get stuck to each other, we can get these little globs that look like spider webs, look like flies, look like a little translucent ball even. And so those things can kind of happen as we put candles on our birthday cake. Typically the brain will start to ignore them. May take a couple of days, may take a couple of years, but that brain will ignore them and start to kind of fade them away to where they're only noticeable during really bright lights out in the sun, that kind of thing. And so if they're not going away quick enough, if they're really big and really bothersome to you, there are different procedures we can do. There's a few different surgical procedures that can get rid of them. And actually some eye vitamins have shown some promise as far as getting rid of them or making them smaller and less noticeable to the brain. The main thing we want to do though is worry about and watch for retinal detachments and retinal tears. And so if they're happening and you're seeing curtains, you're seeing a lot of flashes of light with them, or there's a whole lot of them there, or you're just nervous about them for any reason, it's always best to get an eye exam in that situation. I'd rather take a look at things and say, hey, it's no big deal, sorry we wasted your time, than for you to sit at home or just watch a video for that matter and say, oh, it's not a big deal, no need to bother anyone about it. Because retinal detachments, retinal tears, they are things that need surgery pretty quick. And so again, most of the time these floaters are harmless and don't really mean anything or do anything, but we do need to keep an eye out for those big scary things. So if you have questions, if you're experiencing these things, highly encourage getting an eye exam. Don't let this video serve as that eye exam. Reach out to somebody and make sure that things are being checked on properly. But again, if it's just the floaters, you've been checked out, nothing to worry about, nothing to stress about. And as always, this doesn't replace an eye exam or the need for one. It's just here to kind of supplement what is being told during eye exams. And if you have any questions, I'm always here.